The numbers are increasing, but they're up to 2,800 in the last 24 hours. The government are just trying to keep people out of hospital. If the hospitals just get too crowded, that's when the concern happens. It's a concern in terms of its mutation and its transmissibility, in that it transfers easier between people, and that's their concern. But still not a lot of information in terms of its effectiveness against our vaccines.
The World Health Organization is worried countries are re-implementing travel bans. The global economy is in a tailspin. Now, scientific community is saying that the new variant of concern said to have been first detected in South Africa is horrific and more dangerous than the Delta variant, the deadly Delta variant that had swept the world just barely a few months ago. Now, this new variant of coronavirus, which is now been named Omicron by WHO, has the world holding its breath. It seems to be happening all over again. And I have with me South African journalist Peter van Onselen with us here. Peter, what are South African scientists saying about this variant? We understand it is of concern because of the high number of mutations and the rapid speed with which it spreads.
Indeed, Aditi. You guys call it Omicron. They've named it in a press briefing yesterday. It was named as the COVID-19 B11529. So that's what they've called it. And as you say, the concern is the mutations. Apparently there are 30 mutations. I'm not a scientist, but this is how they described it. 30 mutations in a spike protein. So, in layman's terms, it's a concern in terms of its mutation and its transmissibility, and that it transfers easier between people, and that's their concern. But still not a lot of information in terms of its effectiveness against our vaccines. In South Africa, we've had the Pfizer vaccine and the J&J, the 2-dose Pfizer and 1-dose Johnson & Johnson vaccines. Those are the ones that are available here. Not a lot of information in terms of its efficacy against this new strain. So still a lot of unanswered questions. You mentioned a tailspin. The South African government seem to be in a tailspin right now. They're not quite sure how to deal with the situation. The president is meeting with the National Coronavirus Command Council as we speak right now.
How worrying is the situation there?
We need to put things into perspective. Looking at the UK, they've had over 50,000 cases in the last 24 hours. South Africa has had 2,000. That is the latest figure from our National Institute for Communicable Diseases. So over the past few months, we haven't had a lot of cases. And the death rate is low as well. The only concern now is our vaccination rate. The concern is that people are just not getting vaccinated, and the youth are not getting vaccinated. So the government are on a big drive at the moment to try and encourage people to be vaccinated. So there is a lot of vaccine hesitancy. But if you look at it globally, Aditi, our numbers are not as bad as, let's say India, for example, or even the UK or the US. Over 24 million doses have been administered today, as of today. But the concern is that there's an oversupply of vaccines at the moment. We're actually having to turn away vaccines because, I think the government aimed to get 70% vaccinated by December. Now we're 3 days away from December, and they're nowhere near that target. I think we're sitting on less than 50% of people that have been vaccinated. So that's the major concern right now.
Are people wary of another round of lockdowns?
Yeah, it looks likely that that's going to happen. To what extent he's going to lock it down is going to be interesting to see. Possibly what he's done in the past is implemented curfews, 10 or 11 o'clock at night curfews until early mornings. He's put ban on alcohol, the sale of alcohol, because there are a lot of links between, gatherings, large gatherings that may well be implemented as well. At the moment, for outdoors, I think we're up to about 50,000 people. So that may well be a strategy that he takes in lessening the amount of people allowed at both indoor and outdoor gatherings. The concern is the travel. People have been devastated. We're entering into the holiday season here, where people travel both locally and internationally. And it is the number of calls that have been received on social media. We, like you guys, many people haven't seen their families for years and years and years, 2 years since the coronavirus hit. And finally, things were sort of opening up. Our cases were down. And now, just in the last hour or so, Australia have put us on the red list as well. The United States have put us on the red list. The United Kingdom have put us on the red list. And there are a lot of petitions going around South Africa at the moment to try and get a sense of perspective here. Just recently, the International Relations Minister has said that she's slammed the flight ban and saying that it's been rushed. So a lot of people are broken. I mean, they're emotionally absolutely broken right now.
Thank you, Peter, for joining us, and thank you for giving us that insight of what's happening inside South Africa.